Imagine tending to a beautiful, vibrant garden, meticulously choosing each plant for its renowned health benefits, especially as you seek to nurture your well-being in your golden years. You select an array of colorful vegetables, confident in their power to strengthen and protect. But what if I told you that amongst those trusted green allies, a few, if not understood and handled with specific wisdom, could paradoxically act more like hidden weeds, quietly undermining the very foundation of your heart's health? This isn't a fanciful notion, Sarah. It's a clinical reality I encounter with concerning frequency when discussing diet with my senior patients.
Welcome to Health Voices. I'm Sarah. That's a truly thought-provoking analogy from Dr. David Miller, senior cardiologist at the National Heart Institute, who is with us again today. Dr. Miller, likening some vegetables to hidden weeds in a health garden, is a powerful image. It suggests that even with the best intentions of eating healthily, seniors might unknowingly be consuming foods that aren't supporting their heart as they believe?
Precisely, Sarah. The garden of our diet, especially after 60, requires not just enthusiasm for healthy foods, but also a deeper understanding of how these foods interact with an aging body and any medications being taken. Some vegetables, revered for their nutrients, can, under specific circumstances, inadvertently contribute to problems like elevated blood pressure, interference with vital heart medications, or even pose risks due to how they're prepared or their potential for bacterial contamination, which an older immune system might struggle with. Today, I want to shine a light on 5 such vegetables of concern, not to demonize them, but to empower our listeners with the knowledge to navigate their dietary choices more safely and effectively.
That perspective is incredibly important. Empowerment through knowledge. So these aren't necessarily bad vegetables in all contexts, but rather ones that require specific awareness for seniors?
Exactly. It's about context, preparation, potential interactions, and individual health status. The first vegetable we'll discuss is a perfect example of this complexity. It's a leafy green universally praised as a superfood, yet it demands careful navigation for many seniors. We're talking about spinach.
Spinach. That is a surprise. How can spinach be a concern for heart health in seniors?
Spinach is packed with vitamin K, crucial for blood clotting. However, for seniors taking blood thinners like warfarin, often prescribed after a heart attack, stroke, or for atrial fibrillation, large or inconsistent amounts of vitamin K can counteract the medication's protective effects. It essentially thickens the blood when the medication is trying to keep it thin, increasing the risk of dangerous clots. Many seniors are unaware of this critical interaction. They feel fine, thinking their medication is working, while internally their defense against a clot is weakened. I've seen patients suffer further clotting events because they suddenly increase their spinach intake through smoothies or large salads without medical advice.
So, consistency and communication with a doctor are key if consuming spinach while on blood thinners?
Absolutely. Spinach isn't an enemy, but inconsistency in vitamin K intake is. If you eat it, do so in moderation and maintain a consistent intake level. And always inform your doctor about your dietary habits, especially with vitamin K-rich greens, so your medication can be managed effectively. What you eat can either support or sabotage your treatment.
That's a vital point. What is the second vegetable on your list, Dr. Miller? You mentioned it might be a salty trap.
Number 2 is pickled cucumbers, or pickles. They're crisp, tangy, and a common side. But for seniors, especially those with high blood pressure or heart issues, this seemingly innocent snack can be problematic. Pickles are soaked in brine and packed with sodium, sometimes over 1,000 milligrams per serving, which can be 2/3 of the daily recommended salt limit for older adults.
And that high sodium content directly impacts the heart?
Yes, excess sodium causes your body to retain water, increasing blood volume and putting enormous pressure on your heart and blood vessels. Over time, This leads to hypertension, arterial stiffness, and can contribute to heart failure. Many patients are baffled by their persistently high blood pressure, despite eating healthy, never suspecting the pickles on their plate. Salt damage is silent until a serious event like a stroke occurs. Seniors' kidneys also filter salt less efficiently, making them more vulnerable. Reading labels for sodium and flavoring foods with herbs or lemon instead of salt is crucial.
That's a clear warning about hidden sodium. What's the third vegetable that might pose a risk? You mentioned something about fiery ingredients.
Number 3 is red chili peppers, especially the very hot, concentrated varieties. For many, spice is integral to food enjoyment, bringing flavor and tradition. However, potent chili peppers, containing capsaicin, trigger a stress response. They stimulate the nervous system, raise adrenaline, and increase heart rate. While a younger, healthy person might tolerate this, after age 60, when arteries can be more rigid and the heart more sensitive, the stimulation can be dangerous.
So it's not just the heat, but the body's reaction to it?
Precisely. Blood vessels can tighten, blood pressure can surge, and if pre-existing heart disease or hypertension is present, a very spicy meal could potentially push the heart into a dangerous rhythm or even trigger an angina attack. Over time, frequent consumption of very hot chili peppers might contribute to chronic inflammation in the vascular system. This isn't about eliminating all flavor, but about choosing wisely. Mild herbs, garlic, ginger, and citrus can enliven meals without stressing the heart. Comfort shouldn't come at the cost of cardiac strain.
Important advice for those who love spicy food. What's the fourth vegetable, Dr. Miller? You hinted that even a lauded natural medicine could turn against the heart if misused.
Number 4 is raw garlic. Garlic has a celebrated history in natural healing, praised for benefits like lowering cholesterol and thinning blood. Many seniors trust it deeply, adding raw cloves to meals or even swallowing them whole. While garlic is powerful, that power, when misused or not understood in context, can become problematic.
Specifically, what are the risks associated with raw garlic for seniors, especially those on medication?
Raw garlic is a potent natural blood thinner. When combined with prescribed anticoagulants like warfarin or antiplatelet drugs like aspirin, it can dangerously amplify their effects, increasing the risk of internal bleeding, excessive bruising, or even life-threatening hemorrhages. I've treated patients with severe bleeding episodes who were unknowingly overthinning their blood by consuming large amounts of raw garlic alongside their medication. Additionally, large raw quantities of garlic can also lower blood pressure abruptly. For someone already on hypertension medication, this can cause dizziness, fatigue, or fainting, potentially reducing vital blood flow to the heart.
So, even with natural remedies, understanding interactions and dosage is critical?
Absolutely. Even natural foods have limits, and an aging body responds differently. Cooked garlic in moderation as a culinary ingredient is generally fine, but using large amounts of raw garlic as a daily dose, especially if you're on heart medications, requires a serious discussion with your doctor.
That leads us to your fifth point of caution. This one relates to something often seen as the epitome of freshness, but might carry unseen risks.
Indeed. Number 5 is raw sprouts, like alfalfa, bean, or mung bean sprouts. They look fresh, vibrant, and are often praised for their enzymes and raw energy. Many health-conscious seniors add them to sandwiches and salads. However, sprouts are grown in warm, moist environments, ideal conditions for bacteria like E. coli, salmonella, and listeria to thrive.
And seniors are more vulnerable to these foodborne illnesses?
Much more so. As we age, our immune systems generally weaken. What might be a mild gastrointestinal upset for a younger person can rapidly escalate in a senior to severe dehydration, sepsis, or even a dangerous heart lining infection called endocarditis. I've seen cases where contaminated sprouts led to hospitalizations and worsened heart conditions because the body, already stressed, couldn't fight off the infection effectively while also managing heart issues. If you enjoy sprouts, the safest approach is to cook them thoroughly first. A quick sauté or steam can kill harmful bacteria while retaining much of their nutritional value and flavor.
Dr. Miller, after discussing these 5 vegetables and their potential risks, our listeners are likely wondering what vegetables they should be focusing on to truly protect their heart. This is your 6th key point.
This is the empowering part, Sarah. The focus shouldn't be on fear, but on positive choices. Excellent vegetables for heart health after 60 are those that reduce inflammation, help balance blood pressure, nourish blood vessels, and work harmoniously with medications. Think of steamed broccoli, gently roasted carrots, sautéed kale, with consistent intake if on warfarin, sweet potatoes, cooked tomatoes, rich in lycopene, and heart-healthy legumes like lentils and green beans. These are rich in antioxidants, potassium, fiber, and plant compounds that protect arteries and lower strain on the heart. They are kind to the body, easy to digest, and support a stable blood sugar and pressure. After 60, the heart needs consistency, balance, and foods that nourish. Simple, warm, healing meals like lightly steamed greens, a baked root vegetable, or a bowl of bean soup made daily can make a significant difference. Flavor with herbs like rosemary, turmeric, moderate garlic, and fresh lemon. Not excessive salt or harsh spices.
That's a wonderfully positive and practical list. Finally, Dr. Miller, the source material concluded with a very profound message about our heart, our choices, and the time we have.
Yes. By the time you reach your 60s, your heart has beaten over 2 billion times, asking little in return but your mindful care and attention. Aging isn't about giving up. It's about getting wiser, knowing that what once worked for your body might need adjustment. The vegetables that helped in your youth might need different preparation or consideration now, especially alongside medications. But the most crucial message is this: it's almost never too late. The body has a remarkable capacity for healing. Every small positive change you make today, what you eat, what you avoid, how you move, how you rest, can begin to reverse years of silent strain. I've witnessed seniors regain strength, clarity, and energy, not through extreme measures, but by paying attention and making better choices, one day at a time. Consistency is key, not perfection. Your heart still has time, strength, and love to give. So start today, revisit your plate, rethink your habits, and reclaim your energy. Your next heartbeat is a precious gift, and it's yours to protect.
Dr. David Miller, that is a truly powerful and inspiring message. Thank you so much for sharing these critical insights and practical advice with our Health Voices listeners today. It's been incredibly informative, and thank you to our listeners for joining us. We hope this discussion empowers you to make heart-healthy choices every day. Until next time on Health Voices, be well.